Go ahead.
Hi, this is Julie Lubinsky. I am the Associate Director of Digital for the Christopher and Dana Reeve Foundation, and I'd like to welcome you all to this month's edition of Chat with Nurse Linda. I'd like to tell you a little bit about her. She's been a leader and a provider of rehabilitation nursing for over 30 years and a friend of the Christopher and Dana Reeve Foundation for close to 20. She's a moderator in our online community in our Ask a Nurse discussion, where she focuses on contributing functional advice, providing the how-to on integrating various healthcare improvements into daily life, and answering your questions. And once a month, we're lucky to have her live to chat with us. And I will now turn it over to Linda. Hi, Linda.
Hi, Julie, and thank you so much for the lovely introduction. It's wonderful to be here with you today. I'm really excited about our webinar. I've been looking at some of the questions that people have written in, and we have a real potpourri as we usually do. But before we start with the questions, I would just like to talk about the blog a little bit. We've had a bit of a wide-ranging topics in our blog this last month. Starting out with some research, from what propelled this idea was that I was fortunate enough to get to attend a conference of the Academy of Spinal Cord Injury Professionals, which is always a wonderful place to go and get new information and new ideas and to connect with colleagues. It's always nice to go to a conference when you're there and everybody is kind of interested in the same thing. So you immediately have all these friends because everybody wants to talk about spinal cord injury and what we can do to make that condition more livable, and also looking at ways to resolve the condition. So it's always a good conference to attend, and there were a lot of interesting things that I heard and saw, lots of new equipment that's coming out on the market, lots of things that they're working on. One of the primary things that's currently, it's on the market, but really not terribly accessible to everyone. Anyone can obtain the items, but sometimes the cost of the items that are new on the market are kind of a little bit prohibitive for some people. So there was a lot of exhibitors there, and there were talks about the exoskeleton, which I think is just a marvelous idea because it's a support frame that you can wear around your body, and with the help of a power pack, you can walk using the support frame. Usually there's some other kind of support that's also used, such as a cane or other type of ambulation aid. There are criteria for getting these devices, and as I say, they are newer. They're on the market. They're available. You can purchase one if you meet the criteria. You have to have therapy to learn how to use the device. They're very interesting because, you know, it's just a neat thing to be able to see people to utilize, and those people that were demonstrating these devices. As with all new things, the price is, of course, very high, but as electronic information, things become more tinier and things become more consolidated, the prices of these devices will go down. And I'm sure some of the requirements will be less restricted. So if you have too high of an injury, there's not enough upper body support to hold you up, and you have to have somebody walk behind you when you're using one of these in case you would tip over. And so there's just a lot of criteria. You have to spend a lot of time in therapy. Holding your body upright is not an easy thing to do when you have some paralysis. You can pretty much brace the legs and the hips and get support that way. The hard part of holding up the body is in the trunk, where if the trunk muscles are weak, it's more difficult. So you have to wear a higher support, which it makes the device even heavier, even though they're made out of the lightest products that are known to man. But it's still, it's a fabulous idea, and it's certainly on the horizon, and I think we're going to see more and more of these. There were also lots of unique ideas for wheelchairs and getting around. There's always at these conferences, there's a lot of information that's discussed about the latest research and what's going on with that. The new president of the organization is a urologist, so we had a good sampling of bladder information, which is always nice to hear as a nurse. I'm most interested in bowel, bladder, and skin care, those basic nursing functions. So those always, are keenly interesting to me. And so how we can do better in helping individuals who have paralysis. I did want to talk a bit. I did put information about the blog. If you're interested in research studies, there's ways that you can find out about them, even if you don't have an academic medical center in your area or somebody who's conducting research. And that is to go onto a website called clinicaltrials.gov. Anything that is funded by any government money will be listed there, any kind of study. So if you're interested in heart disease, you can search on heart disease and all the studies will come up. If you're interested just in spinal cord injury, you can search on that. All the studies will come up. So you will see what studies are being conducted, who's recruiting, and if the study is still open or closed. Now, not everyone can travel freely all around the country any time. I know I can't just, I'm going to go to, wherever today. We all have financial constraints. But you can at least see where these studies are being conducted. Sometimes they're paper and pencil type of studies or studies that are collecting information about your care requirements or your care needs, and you can participate over the computer or through the mail. In some of these studies, the clinical trials, you have to be able to be present at the researcher's location to be able to participate in those. So if you're not able to travel or if you don't have the resources to travel but you're still interested in what's going on in clinical trials, the results of the studies that have been funded are there as well. So you can see what people are studying. You can see the results of their clinical trial. You can get a lot of information. So it's kind of nice to be able to log on to that site and to see what's going on. There are other studies that are sponsored by drug companies. So if you're familiar with any drug companies, you can look on their websites. Sometimes they have government funding and sometimes they do not. So those wouldn't be on this particular website, but you can look those up. So if you think, well, I don't really know what drug companies are working on experimental drugs, so just Google spinal cord injury research, and sometimes those studies will become available to you so you can read their information of what they're working on and what their goals, what they're trying to accomplish. Another thing to think about is if you would like to participate in research, whenever anything is funded by the government, the research trials come in 4 phases. And so you might have the opportunity to participate, and so you want to think about those phases and help make that part of your decision. Sometimes when people have diseases for which there's not treatment necessarily readily out there, people are real easy to join up to a study, and you really want to think about if you want to do these kind of studies or not. So government studies are always in 4 phases. If a study is being done privately by a drug company or a gene company or any other kind of sponsored research, they will do their studies in these 4 phases the same. So it's kind of equal across the board. So the first is what's called a phase 1 study. Those are very small in number. They're the first time that particular piece of research is being conducted in humans. So the researchers have gathered a lot of information from the laboratory, and they've tried to correlate that with the human body, and so they become prepared. They say, okay, we're going to try this in humans. It's the first time. So if you're offered a phase 1 study, it's the first time that particular medication, or it can be a therapy or a new implantable device or a gene, some type of regulating the genes in your body. So anytime there's any kind of human manipulation and it starts out as a phase 1 study, what they're going to be looking for is to see if what they're doing has any kind of safety concerns for that individual, for human beings. So if you're looking at phase 1, you're not really looking at any kind of curative type of things. People who join phase 1 studies always think, well, gee, this will be the miracle and I'll be the one that this will really work for. But in reality, they're just looking at this for safety. Is this going to be harmful for humans or not harmful for humans? So it's done very cautiously just to make sure that no one's going to have any harm. The phase 2 studies are done with a few more people, and these might be like maybe even up to 100 people, but probably even less. The phase 2 studies are done after phase 1, so they know there's no harm, and that's where they start looking at dosage. So sometimes when you're looking at medication or therapeutic treatment, you can think, well, a little bit does good. Will more do better, or will more cause some other kind of harm? So again, phase 2 is looking at just trying to figure out the dosage. If it's medication, how many milligrams of the medication should be given. If it's a therapeutic treatment, it might be how many sessions should be given. So it's really looking at dosing. And then phase 3 is where you really get into those large number of study people. So that might be even up to 1,000 people might be in that study. And at phase 3, they're refining the dosage. So you might see some improvement in a phase 3 study. You might see some in a phase 2, but probably unlikely. But in phase 3, you might, if you're in the group that gets the medication, there's always the group, the placebo group, the group that's not getting any medication or treatment. So if you're getting something, you would notice that in the phase 3 study. And then right before they go to market with the new product is the phase 4 study, and that is when you're getting what the usual treatment will be when it goes to market, whatever the product may be. So if you're considering doing a study, you might want to think about, if it's a phase 1 study, you might want to think, well, I would really like to participate, but I really need to think about my own future, and will participating in this study prohibit me from going into any future studies? That's really the critical key. Of course, the phase 4 studies, people think, oh, that's right before market, so that's going to be perfectly fine, and it's going to be a wonderful opportunity. But you have to remember that the treatment or the investigation is still under study. It's an experiment. So not quite all the bugs have been worked out yet. So these are kind of things you want to think about if you want to dive into a phase 1, or if you want to wait until the study gets a little more mature. Some of the other things we talked about this week was foot care. And it's important to think about your feet. The weather's starting to turn cold now. Whenever we have extremes in temperatures and hot or cold, we have to think about our skin and the thermoregulation of our body. Sometimes individuals with spinal cord injury have difficulty regulating their body temperature. And so you want to be sure and dress warm, and that includes your feet. I see my patients, or sometimes I'm at a football game and I'll see somebody and they've got their feet completely open to air. There's just their naked feet sitting out there. And they say, well, I don't feel my feet, so it doesn't really matter. But it does matter, because your body's still going to react to that. Your feet are the part of your body that's the farthest away from your heart. So it's difficult to get a lot of warm blood down there. It's difficult sometimes to get more circulation. You think about people who sit long periods of time, they have edema in their feet. If they're sitting for whatever reason, spinal cord injury, or they have some other problems that make it difficult for them to move around, you'll see that their feet's the first thing that get a little puffy. They get a little edematous. It's because it's so far from the heart. It's hard to pump all that fluid back up sometimes unless you're moving your legs around. So doing range of motion exercise is important for bringing that fluid back up to the heart, so it can get pumped out through the kidneys and you can get rid of that extra fluid. But it's also important to keep your feet warm and toasty, because that's going to affect the rest of your body and your body temperature. When you have your feet on the footrest, be sure and place your feet solidly on the footrest. It's very easy to have the toes slip over the top so that your feet instead of being at a 90-degree angle to your leg, your feet suddenly your toes are in alignment with your legs, so they're stretched out. That is muscle shortening in the back of your legs, so you want to keep your feet solidly planted on that footrest. Don't let them slide over the top and be with the toes pointed down. You always want your toes pointed at a 90-degree angle from your legs, because that will keep your tendons in the right length, and it will keep things a little more supple. Do that range of motion on your ankles so that your ankle won't get contracted, so you won't have problems in that regard. And keep those toes and those feet covered and nice and toasty during the cold weather. The other blog that was on this month was about driving, and thinking of feet makes me think of driving. So a lot of times people think that they can't drive if they have a higher level injury, and there are a lot of programs and a lot of information out now about driving. And so just about anybody can drive. Some of the concerns that you might have is to be able to get an accessible vehicle so that you can get in and out. Again, we're talking high-cost items. You can get them either pre-made, or you can go to a regular car dealer. You can look online. There's a lot of information about accessibility of vehicles by the manufacturers. You can go to specialty mobility car stores. If there's not a mobility dealership in your area, you can look up buying an accessible van. There are some different companies in different parts of the country. If you would like to purchase an accessible van, but it's not close to your home where you could go shopping, like at the car lot to go see what's there, you can contact these companies, tell them what your needs are, and you might want to work with a therapist so that you're really clear on what your needs are, so you're not purchasing something you don't really need or overlooking something that would have been really helpful. And then these big dealerships will bring a vehicle right to your house and let you get in and out of it, try it, see how you like it. And, of course, they're counting on that you're going to purchase that, so you have to be pretty certain about your finances before they arrive at your door. There are therapy programs that will help you with strengthening if you are not sure about your arm strength. Of course, you can get accessible gears on your car, so that could be up by the steering wheel. There are all kinds of joysticks. There's just the adaptive equipment for vehicles is really just a wide range of things. So you can get pretty much anything that you need to fit your body. Now, if you need to have strengthening for your arms, there are troughs and there are armrests that you can use so that you don't have to hold up your arms the whole time that you're driving. But there's also therapists that will help you strengthen your arms so that you have a little bit more control. Of course, the other thing you want to think about is safety in your vehicle. So sometimes people who have spinal cord injury also have an undiagnosed head injury, because if you think about it, if you have an injury in your cervical up by your neck and that part of your spinal cord from a trauma, usually what happens is that's pulled because the weight of your head is bounced around off this little bitty structure of your neck. So sometimes people will have an undiagnosed head injury. It's maybe very mild, but it's something you want to consider before you get behind the wheel of a car. Another thing might be visual problems. If you have paralysis from like a stroke, that can affect your visual field, so you want to make sure that you can see off to the sides, that you don't have any blindness from a stroke or other sorts of problems with your vision. So just be sure that you're safe, but driving is very much more accessible nowadays than it has been in the future. So there's lots of good things that are going on out there, so let's answer some of these questions. And so we have somebody who's written in about they've tried everything to help their fiance, but nothing has worked as far as mental issues. And so should I let time do its work? So, adaptation through to spinal cord injury from a mental point of view is it can be a lot different than adaptation from the physical point of view. So I hope that your fiance is seeing someone for counseling or, trying to work through those issues. Sometimes people think, oh, I'm just tough and I'll just get through this. But really, there are people who are trained, psychologists who are trained to help you get through these issues. So you don't have to tough this out on your own. So please be sure and get some psychological counseling. This patient, the person writing in is the partner of the person with spinal cord injury. It's difficult for that partner as well, so you might need to both get some counseling so you can better learn how to help your fiance. But finding someone in your community that can provide some counseling that will help you both get through this and learn how to adapt is something that you really should seek into. There are medications, of course, that can help some people, but some people don't need medication. Some people will do much better with the counseling. And also remember, too, that even though you've adapted, maybe you're getting along pretty well, things are going great. It's not the way you would wish it to be, but you're handling the situation what it is. And then something will happen, and it's like all of a sudden you're just snapped right back into a doldrum, a depression. There's a title for this. It's called chronic sorrow. So you just get out in the world and you just get thinking you're doing pretty well, and then you're confronted with something that can be something as simple as you can't get into a building where you want to go, or maybe somebody says something to you or looks at you a certain way, or you have a complication of spinal cord injury and suddenly you're right back in that mindset where you were before. So counseling can help you work through those issues in the current time, but also through the long time. So keep sticking with it. Keep working towards it. It's different for everyone. Some people appear to adapt right away, only to kind of crash out later. Some people take a longer time adapting than other people. It's so very individual. We also have Dr. Dan that you can consult with through the Christopher and Dana Reeve Paralysis Foundation, who has a blog, so that could be an opportunity for you as well. There's also a peer support group at the foundations that you can contact them and find somebody in your area who has a similar situation. They can help you find a counselor or psychologist. So there's all kinds of resources available to you. So use them all. This is the time to use them all. They're all free, so it's time to just grab onto them. The next question is from somebody who wants to know if there's such a thing as post-viral paralysis. Why, yes, there is. The most common one that we see today is post-polio syndrome. Polio is caused from a virus. And as you know, polio was very prominent. Oh, gosh, I am thinking like in the 20s, 30s, and 40s. The virus was pretty prominent. We then got the Salk vaccine, so we are all vaccinated from having polio now. So after that wave of individuals got past their polio, some were less fortunate than others with residual deficits. Many even died. But a lot of people survived, and we're seeing right now a lot of post-polio individuals who have gotten older. So as they've gotten older, they've gotten less mobile, and the residual from their polio time has come back. The virus hasn't come back, but the residual deficit. So maybe they were able to compensate for a problem with walking, or they were able to compensate with adaptive equipment, and so they were going along. But as they got older and their bodies became, succumb to aging, as we all do, And as they got things like arthritis, it's harder to get around, we're not as agile as you get older sometimes. And so we're seeing a lot of that. Now, there are other people who end up having viruses of any kind of thing, maybe even the flu, other kind of viruses, and sometimes they like to settle in a nerve. And so what happens is if you have nerve problem, you need to go right away to your doctor. There's some antivirals that can help. They can't always stop the virus from settling in there, but there can be consequences from any kind of viral infection. Now, antibiotics will not help a virus. They only clear up bacterial infections. So you don't want to go to running to the doctor every time you get a cold, because you're going to become immune to the antibiotics and allergic to them. And then there's going to be a lot less options for you when you have a bacteria that you need antibiotic treatment, because you'll be able to take so less of them. So overuse of antibiotics is a real problem in our society today. People think every time they get a sniffle, oh, I need an antibiotic, I have a cold. Antibiotics won't help you clear up that particular bacteria, but they do make your symptoms seem like they're less, so people think that they're helping, but they're really you're just really building up immunity. So, if you are sick, go to the doctor and then follow their instructions. If you need antibiotics or if you don't need antibiotics, do what they say that you need to do about that, because you can lead into a lot of other problems. But if you do have a virus and that affects a nerve in your body, you will want to seek treatment for that and get therapy for that to restore that functioning of that nerve, and to find compensation mechanisms to adapt to your level of function so that you can get over that quicker. By not doing anything, it's going to be slower to heal. So you want to get that handled right away. So yes, there is a post-viral paralysis. And if you have any kind of paralysis of any type, you need to get yourself to the doctor right away to see what's going on with that. We have another question about a person who's been quadriplegic C4-5 since 1973, and he's been taking Baclofen with satisfactory results. But suddenly, about a month ago, the spasms have become more severe. And so they went to a neurologist, and he put him on diazepam in addition to the Baclofen. So something to think about whenever you have a sudden change like this, because the word suddenly is actually in here. So suddenly a month ago, so they've really pinpointed the time. So whenever you're able to really pinpoint that time, it could be, and I don't know because I don't know your situation individually, but as a general rule, whenever there's a sudden change in spasms like that, it's usually from some other source. So something's going on in the body that the body doesn't like that's happening. It could be a UTI. It could be upset stomach and diarrhea, or it could be something like a gallbladder attack or appendicitis. It could be an infection anywhere in the body. It could be a blood clot. So you went to the doctor, and I'm assuming they ruled out any other type of complication. So they've added the diazepam, and that's Valium. And so what happens with that is people get very, very groggy when they start taking that, and it's dissatisfier for people. So after a while, you become used to taking the medicine, and you kind of get over that grogginess. But if you don't want to be taking the diazepam, you can try that, talk to the doctor and say, things seem to be under control. Can we back off some of the diazepam or Valium? Now, you don't want to do this on your own accord. You just don't want to try this at home. You want to set a plan with a doctor, because when you're on a drug like Baclofen, or you're on a drug like diazepam and Valium, if you stop taking that, you can have serious consequences. These are drugs that have to be titrated off and weaned off and not just stopped. So you need to set a plan with your doctor that would be the right course of action for the size of the individual. So if they're a great big person, they can wean differently than if you're a little bitty tiny person. Age also affects the weaning process. So older people need to wean off much more slowly than younger people do. But the big thing is you don't want to wean off on your own. You don't want to stop taking the medication because the spasms will come on more severely, and there can be all kinds of medical complications from withdrawal and serious problems that sometimes do not go away. So don't wean off yourself, but talk to your doctor. If there's a different medication that you want to take, sometimes people take more Baclofen. If you want to get off oral medications altogether, you could talk to your doctor about a Baclofen pump to see if that would be satisfactory. It is a surgical procedure where a little pump's put in the abdomen, and then a little tube is placed around into the spinal cord. So instead of taking the Baclofen and the diazepam by mouth, you can put this into the pump. So the pump goes under the skin. So there's a needle that passes through the skin, and you fill this pump with the Baclofen, and you can put the diazepam in there as well. The doctor would insert these drugs into the pump, and then the medicine just goes right to the spinal cord. It doesn't have to go all through the gut, all through the body system to eventually get to those muscles that you're trying to relax. So the Baclofen bathes the spinal cord with the drug, so you don't lose so much of the drug as it goes through your body. You can use much higher dosages. Now, it might be something that you want to think about. It might, that I might be reading more into your question than is actually here. But if you have trouble and you keep going up on the Baclofen, you keep adding more, you might want to think about a Baclofen pump. You don't just go in and get a Baclofen pump inserted into your body and then, oh, wait a minute, we're not sure what's going on. There's actually a trial that you go and you have the medication injected into the spine, just like you would do a spinal tap, but they inject medication in there. They see if it works for you first before you go through the risk of the surgery and all those kind of things. You always want to think about your risk and benefits before having surgery. So you get a trial first, see if it works. And I've been with many of these trials, and when it works, it's just fabulous, and it usually does work. But then, the people have relaxation of their muscles, and when that wears off, they're like, well, wait a minute, I don't want this to go away. It felt, I felt right. And so after the trial, people are very antsy then to get their Baclofen pump inserted. So you're still on low levels of medications, actually, but that might be something you want to think about in the future, talk with your physician. So if you're unhappy with the side effects of the diazepam, they will go away over time. The body becomes used to it. If you want to talk about the Baclofen pump, that would be a good thing. Now's the time to start thinking about it before you're in the situation where you really have to do something seriously, like we need it right now today. So think about it and learn about it now so that you'll be able to make good decisions in the future. Okay, you can even look online for Baclofen pump, and they've got a lot of information online about it and explains it all. So that will be helpful before you ask about it if you have all the information and can narrow down your questions. So we have another person that is maxed out on their nerve medication. The only medications that really treat nerve pain are Neurontin and Lyrica. They're specifically designed for treating nerve pain. There are other medications like antidepressants taken in very, very small amounts. This is kind of interesting. One of those outcomes of research is that when they were testing antidepressant medications, they found they needed a certain amount, like 100 milligrams, treat depression. But if they gave people like 10 milligrams, it eased nerve pain. So it's not enough to treat depression, but antidepressants and sometimes anti-seizure medications are used to treat nerve pain, and they've been successful with those. So I don't know what nerve medication, but anyway, they're having a lot of burning on the left side, and it seems to have gotten a little worse. Is there anything I can do to get rid of it? It's like a frying pan, especially at night. And it seems like nerve pain comes on especially stronger at night, which really is a tribute to how much we can distract ourselves in the daytime. But at night when we're laying in bed, you notice it, it's there, and it really acts up at night. And so there's different medications that you can try. Some people will use just like a cold towel, with just cold water in it. Now, not an ice bag, because if you have trouble with sensation, you're going to have a frostbite injury. Or a towel with just a warm cloth with warm water in it, not a hot water bottle or a heating pad, because you will burn yourself. So you don't want either of those, just a towel or a washcloth with hot or cool water. Sometimes that helps. Sometimes if people are able to get in a bathtub, they will find that either the hot or the cool water of the bathtub will help relax those nerves before they get into bed. There is, I said, there's a variety of medications. Sometimes people take more than one. Neuropathic pain is something that is just not easily treated, and there's no exact formula for treating it because everybody is just a little bit different. So sometimes people will take Neurontin or Lyrica, one or the other. You don't take both, but they'll take that and maybe a little antidepressant or a little anti-seizure medication. It's a trial and error process, and it takes about 6 weeks for these medications to become effective in your body. So sometimes people will say, well, I've tried this for a week and it's not working. Well, no, it won't work until you've had it in your system for 6 weeks to build up your blood levels. So it's a slow process, very frustrating, but eventually you'll get to a combination. So you might need a combination of medications, but in the meantime, you can try just a towel or a washcloth just with hot or warm or cool water on it and see if that takes away any of the edge. But you'll need to work with your healthcare professional to maybe add a combination of medications. Then there's also another thing that you might want to try is maybe some injections to see if that helps calm the nerves, if that will silence the nerves. This is a much higher level, way further thinking out. There are some surgeries that can help with this, but it sounds like you're not quite there yet for any of that. So work with your healthcare professional on maybe a combination of medicines. Sometimes that will help. So discuss with them what your options would be on that. And the Neurontin and Lyrica, there are some top doses, but sometimes people even go beyond that because after a while their body becomes used to these medications. So if you're at the top of the dosage with those, though, you might want to add a different thing because you need to be if what you're doing is not working, you need to try something different. That's a general rule of thumb. If this isn't working, don't keep doing the same thing over and over again. But it will take several weeks for those medications to build up in your body to see a result for them. So it's really a trial and error and a lot of patience to treat the neuropathic pains. So our next person is looking for an alternative way to heal a sacral wound. They've done the wound vac, and that's a nightmare. That's interesting because, most people love the wound vac, but not everyone does. It's very difficult to get the right seal. If the wound's in such a way, you have to take the tubing around the body so it doesn't keep pulling out. A sacral wound is a hard place to get that wound vac perfectly attached. So I would go back to the wound care specialist and see if there are any alternatives. Sometimes they'll use bridging. So if your wound vac is not satisfactory, and it's a nightmare, and that's the term that's being used, and trust me, I've seen people, it's a nightmare for them to have these wound vacs. Now, wound vacs are lovely in the principle of how they work. So there's a suction that, there's a dressing that's put over the wound. There's a tubing that is attached to the dressing, and there's a real light suction that is pulling on the wound, so all the debris and exudate is being filtered off away from the wound so that the wound is clean and clear all the time and has the opportunity to be healed. Now, that doesn't mean wound vacs are not, how should I put this? So wound vacs are an adjunct to wound healing. They're an extra thing that you can do, and their purpose is to keep the wound clean and to speed up the healing time. That doesn't mean you have to have a wound vac to heal up your wound. So there's other things that you can do. There are other dressings that you can try. There are other treatments that you can try. Some wounds are deep or have tunnels, and so there's packing that's used. Sometimes there's moist gauze that's put in there inside the wound, so that when the gauze dries out and it's removed, it will remove off that dried tissue of the wound as well. That's the same principle, but it's a slower process. There's also medications that you can use. There's enzymes you can put on wounds to help keep them clean so that the wound bed can grow. You always want the wound to heal from the inside out. You don't want to let the skin grow over the top of the wound and you still have the wound inside the body, because that will just close it off and it just festers and then it's just growing inside the body, but you can't see it because now you've got a layer of skin over it. So you want to keep that wound open, and you want to look at what kinds of treatments. So there's all kinds of things that you can use. So you need to see a wound care specialist, which I'm thinking if you're using a wound vac, maybe you have seen one, but maybe not. So ask for a wound care specialist that can look at your wound and tell you what kind of treatment should be on that wound, if there's any ointments or medications, and then what kind of dressing. So sometimes people use a plain gauze dressing. Sometimes they use a dressing that is like a sealant over the wound that keeps things, that allows exudate to come out but doesn't allow bacteria to get in. Sometimes there are different coverings that you will use with that. The only thing that's going to make a wound better is to stay off of it. I have lots and lots of patients that, I need to sit to do that. I just had one gentleman who fought with this wound he had for a couple of years, and I said, you're doing all the right things, you're doing all the right treatments. However, the problem is that you're sitting on it occasionally, and every time you sit on it, you're creating a deeper wound, because that's what the pressure is what causes the wound. And so he finally went and had to have a surgical closure. Now the area is just weaker from the scar tissue and moving muscle flaps around. And then he had to lay in bed, and he was in bed for more than 4 months, keeping off his wound, doing nothing. But he could finally see that if he didn't do that, the wound was never going to heal. And so he's just like, boy, I will never have another wound. I will do my push-ups and I will do all this, because, he had to take time off from work. It was time away from his family. So staying off the wound is what's really going to heal it up. All the other stuff's going to help. It's going to get it better. It's going to keep it clean from infection. But the only way it's going to heal up is to stay off of it. So that is the tough answer there. Okay, so Here's a person with an incomplete injury and had nerve pain, and recently it's gotten worse. So now here this is a little bit differently, because recently it's gotten worse as opposed to the other person said, I suddenly had this increase. So this could be just a fact that maybe the medication that you're taking for your nerve pain, it's just evolving and you need to just up it a little bit. You should also look if there's another kind of problem that's going on that maybe has stimulated the increase in the spasticity. So just like the other person that wrote in, you should be doing the same kind of things. I just think from the wording of your question that it's probably just an evolution of the nerve pain as opposed to something else, because it's just gotten worse recently. So there's not really a pinpoint time for there. Here's a person who has a daughter who has Spina Bifida and is talking about leakage, and is there anything before surgery that could help? Well, yes. She asked about injecting collagens. There is injecting a collagen that can help make the urethra seal tighter. There's also Botox injections if the leakage is coming from a spastic bladder. There's Botox injections into the bladder, which will stop that spasming from going on. There's medications if there's not urodynamic testing that's been done to find out if the bladder's spastic, to find out if the sphincter's spastic. Sometimes the two are working, they're supposed to work together, but sometimes they work against each other. So when the bladder contracts, the sphincter is supposed to open. Sometimes with spinal cord injury from disease or trauma, this one from disease, sometimes, I guess disease, it's not really a disease, but a diagnosis, we'll call it. So sometimes when the bladder contracts, the sphincter, instead of relaxing, will tighten. It's called bladder sphincter dyssynergia. And so what happens is that bladder's contracting, but the sphincter's tightening, and so you have some problems, and then the pressure of the bladder will override the sphincter. So urodynamic testing would be the first consideration to figure out what should be going on. We have another question related to that about suprapubic catheters and also dieting affect UTIs. So suprapubic catheters, a little surgical hole is made right up above the bone of the pubis there, so right straight into the bladder. It's a new opening that's made so that a catheter is placed there, and then the urine is constantly being drained out. Sometimes with bladder spasms this is done. Is another possibility. For children, there's also the mitral fan-off, and more adults are doing this procedure also, where the insertion to the bladder is made through the navel. So especially, it started out with children with little girls not being able to catheterize themselves because of anatomical difficulty. It's hard when you're sitting in a chair if you can't transfer. So a little tract is made from the navel into the bladder, so a catheter is inserted, the urine is drained off, and then the catheter is removed. Whenever you have a catheter indwelling, you have a higher risk of urinary tract infection, and so with the suprapubic catheter, you do have a higher risk. But it can also save complications such as it can reduce your incidence of autonomic dysreflexia, which is a medical emergency. So, the high blood pressure and cardiac problems that come with that. So my advice on suprapubic catheters are to weigh, it's just the same as everything, weigh your risk and benefits. If you're getting a suprapubic to reduce autonomic dysreflexia, that would be a very big benefit over the risk of the surgery. If you're doing it for convenience, that might not be a good benefit, especially if you're a male. If you're a female, and a lot of females have suprapubic catheters, but think about the mitral fan-off as another option. So, you have to lay out all the options and look at the risk and benefits for your individual case. and that's where you want to go with that. Now, as far as diet for UTIs, yes, there are certain foods that will increase your risk of urinary tract infections, and those are sugary drinks, sugary foods, sugary drinks. The sugar is excreted through the bladder. If it's in food, it's going to be excreted through the bowel, but also all the sugar could be absorbed from the bowel, and then it's going to go through the bloodstream and be excreted through the bladder. So you have to be careful about what you eat because bacteria love sugar. That's what they feed off of. It's just like if you're eating sugar and you have that collected in your bladder, the bacteria are just going to say, hey, thanks, you're giving us a good meal here. So you always want to make sure that you have your bladder well flushed, that you're doing your bladder program at a particular, on your schedule so that you are flushing your bladder, and that's really the best thing to do. Water, caffeine is another thing that's another liquid that you can take in. Caffeine has a tendency to dry out the body. It can act as a diuretic. So water is really the very best of all the fluids that you can take in. You need to be very careful about sports drinks as well, as because they sometimes have electrolytes added to them, especially salt, and so you might not be needing extra salt in your diet and in your drinking. So actually just keeping the bladder flushed with water, that is a great thing to do. That does not mean you should go out and start drinking tons and tons of water. You can increase your water just by like a quarter cup a week. Every day for a week, increase it just a quarter cup. And then if you feel like you need to do more, then you can increase a little bit more. Look at how much you're taking in versus how much you're putting out to see if you've got a good balance. I did want to skip ahead because the hour is coming to the close, but there's just this fabulous question in here, and I really did not want to skip over that. And that is that this person writes in that their son John is 37 years old. He's a quad from an accident 10 years ago, incomplete. But last night he wiggled his toes on his left foot on purpose. Does this mean any good news? Heaven's sakes, yes. Whenever you move something on purpose that you couldn't move before, that means that nerve connection has gotten through. So you want to keep practicing that. You want to keep wiggling that. If that nerve connection has gotten through, more are able to come through. The biggest thing, because the nervous system turns over so slowly, and because healing the nervous system is such a slow process, that sometimes you get in the middle of life and you just think, well, this is just the way it is, and okay, so you move on. But your body is always trying to heal itself. So just as John is wiggling his toes, everybody should go through their whole body parts. When you lay down at night and you're resting your mind, you're getting ready for sleep, go ahead and just think about, I'm wiggling my toes. Just think in your head. Picture it. Try to look at your toes. I'm wiggling my toes and see if they'll wiggle. See if you can move your ankles. See if you can move your legs. See if you can work through any of your fingers. And you will be surprised that eventually you might just do it. You want to be able to notify your doctor. When you call them when there's something bad, call them when there's something good. And tell them that your son's able to wiggle his toes. He can call, you can call, and see if you can start getting therapy. This is a change in condition, and usually we tell people to call when there's a sudden change in condition. It's usually towards something happening, and we have to check it out. It might be something that we consider a complication. But you can call when there's a change in condition towards something that's good. And so this is a very good thing. And it's really quite amazing because the accident was 10 years ago, but still the body's trying to heal itself. Unfortunately, for some people, they sit in their wheelchair, they don't do their range of motion, they don't move their bodies, and the muscles get so weak that when their body does heal itself, there's not the muscular function available to take advantage of it. So this is something that's happening. He's wiggling his toes. So get into some therapy and get some movement going so that he can, well, I like to use the word exploit. And exploit is usually has a negative connotation because it's, utilizing something for another purpose. Well, you can exploit things for good, too. You can utilize this toe movement and exploit it into other kinds of movements. So this is an important thing. And I did want to leave on this. When I saw this, I thought, oh, boy, we've got to get to this one because it's so infrequently that people don't tell these kind of things. They think, well, isn't that funny? And look I can do this and I couldn't do it before, and they don't really tell people. They just find it an oddity and they don't really ask about it. But I'm glad that you did because this is exactly how Christopher Reeve started his recovery. He got so that he could move a finger on command, and he called it his party trick. He didn't, I have a spinal cord injury. I've been told I'm not going to have recovery. And so he had this, and it's like, well, isn't that funny? And, of course, his whole recovery was based on this finger movement. If that can happen, then anything can happen. And if it can happen to John, it can happen to everyone else out there. So this is good news for John, and it's good news for all of us, and it's really nice for me to hear. So I appreciate you sharing that story. I think everybody needs to shout that kind of thing from the rooftop. So if anybody is having any kind of return, even if it's a tingle or something that's different, that's the time to also call your health provider and tell them, I'm getting some return. This is happening. I'd like to get into some therapy. You'll have to check with your payer, but if you have a change in your condition, which this is, you might be able to get some therapy and be able to exploit that movement into something else. So John is, as of last night, John is changing his life yet again. So towards something different. So good luck to you, John, and please let us know how that continues because we would like to hear more about that. It gives hope to everyone who's listening. So with that, we are at the top of the hour, and I can't think of ending on a better note. So if you have more questions that I haven't spoken about, I know there's a lot more on catheters, so we could talk about that next time, or you can write into the blog and we'll discuss some of those other things. So basically, look at all your options with catheters. Intermittent catheterization is the process that most people are used because it is the safest. It mimics the usual activity of the bladder of filling and then emptying. So it's a good process to use. If you cannot do that, there's also the suprapubic catheter, there's the mitral fan-off, there's indwelling catheters, there's all kinds of other procedures that can be used. But be sure and get your urodynamic testing completed so that you will be able to look at the options and be educated about what's available for your particular needs. So with that, I'll throw it back to Julie, and I thank you all for coming today.
Hi. Thank you so much, Nurse Linda. And for those of you who still have questions, you can go online, and I put the slide up. You can go online to christopherreeve.org/nurse and ask your question in our community there, and she will answer your question there. And also look on our website for another edition of Live Chatting with Nurse Linda, the end of November. So thank you all for coming, and I hope you have a great day.
Thank you. Bye.
This concludes today's call. Thank you for your participation. You may now disconnect.